मेरा नाम रमेश है। मेरी उम्र 71 प्लस है। मैं एमटीएनएल एम्प्लॉइज़ हूँ। सीजीएचएस पैनल से हूँ और मेरे सीजीएचएस पैनल से होने से की वजह से पिछले 6 महीने से ज़्यादा दिक्कत हो रही थी दोनों घुटनों की।
तो डॉक्टर साहब जो मैक्स हॉस्पिटल शालीमार बाग में कुणाल अनेजा जी हैं, इनसे मुलाकात हुई, इन्होंने ट्रीटमेंट सजेस्ट किया।
Mr. Ramesh Chand, a 71-year-old gentleman, came to me in my OPD with severe pain in both knees. He was disabled with this pain since many years now, and when he presented to me, he was very scared of what I would suggest him next. He has had a stroke history, he had a hypertension history and prostate history, and he had been advised knee replacement by many surgeons but was very skeptical about the results and safety of the procedure. We counseled him and were able to instill confidence in him regarding the procedure and that he can safely undergo both knee replacement surgeries in a single sitting without any concern.
डॉक्टर साहब से मिलने के बाद मेरे फादर ने एग्री किया कि वो सर्जरी करवाने के लिए तैयार हो गए।
27 को ही हमें एडमिट कर लिया, सारे टेस्ट वगैरह किए और 28 तारीख को मेरे दोनों घुटनों का उन्होंने ऑपरेशन किया।
He has had a subvastus muscle sparing surgery which has led to early recoveries. He has left the stick on which he was dependent for more than a decade now, and today he is going home more confident, independent and without any concern.
मेरे घुटने के अंदर टेढ़ापन जो था वो टेढ़ापन भी ठीक हो गया और इस समय मैं व्हील चेयर और के मार्फत भी चल सकता हूँ, सीढ़ियाँ भी चलाई गई हैं मेरे।
And Dr. Kunal Aneja is one of the experienced doctor available here who has pretty much experience in these kind of surgeries. He can really help you. Recovery अच्छी है, मेरे फादर को आराम है, तो I can recommend you Max Hospital Shalimar Bagh.
When he presented to us, he had bow legs, which is gap between both the knees, which is a typical deformity present in the Indian scenario. We were able to restore the alignment and his bow legs were able to get to straight alignment, which is what we want for a normal patient, and he's more confident to walk with a straight leg now.